So in regards to the tummy tuck versus the Brazilian butt lift, which to do first, it really comes down to the individual patient and their anatomy. So I really need to examine the patient. Now, what I typically do is I look at the more preferred procedure, the procedure that has the higher satisfaction rate. And a tummy tuck is year in, year out, the second most satisfied procedure. It gets the highest ratings behind a simple breast augmentation. So that tends to make me lean towards the more favored procedure and say, hey, get your tummy done first. However, there are times where you can utilize that fat in the tummy, liposuction, defer the tummy tuck, just do liposuction, harvest that good quality fat, put that into the butt, get your Brazilian butt lift done, wait 3 to 6 months and then go back and do your tummy tuck, and you've got less fat and get more of a tuck. So you can see the answer can go both ways. So I really like to see the patient, see their anatomy, and make that decision then and there. Yes, all silicone implants are gummies, but there's definitely different consistencies of gummies, and it also depends on the brand. But since this century, the 2000s have come about, all silicone implants are gummy. Several years ago, approximately 4 years ago, we came out with some thicker gummies that are smooth and round, and one of the brands has 3 consistencies: a soft, a middle, and a firm gummy. The other 2 brands, we have a total of 3 in this country that sell silicone implants. The other 2 brands sell and make a medium firm gummy and a firmer gummy. Many tummy tucks, and who's the right patient for that? Well, certainly when you look at mothers who've had C-sections, to be able to get rid of that lower C-section scar, often the scar's indented, there's an overhang of lower tummy tissue there that they want to get addressed. A mini tummy tuck's great for that. However, if you have a bulging tummy wall, the muscular wall is bulging, and particularly if it's the whole tummy wall, above the belly button and below, then a full tummy tuck would be the way to go. If it's just below the belly button and some lower excess skin, then the mini will still certainly take care of it. So how soon can you upsize after your recent breast augmentation? I generally want the patient to give it at least 6 months. They had a recent surgery, let everything settle into their mind, let them find how they fit and feel in their clothing, and then make that decision. Downtime for liposuction, this is a quick recovery. 1 week and you can get back to work. 3 weeks and you can get back to full exercise. So it's one of the quickest of the recoveries for cosmetic plastic surgery. So when do you want to get your tummy tuck after your last pregnancy? Well, first of all, you want to make sure that you don't want to have any more kids, that you're done. And then I would recommend 6 months after the last pregnancy. Gives you plenty of enough time to take care of your child, get your child older and stronger, and you get a little more free time, and then let that body recover from the recent pregnancy. So minimum of 6 months. On a full tummy tuck, the upper tummy above the belly button, the muscles, the six-pack muscles, are tightened as a corset stitch, and even below the belly button, the six-pack muscles are tightened. On a full tummy tuck, the belly button skin is rearranged and the belly button's reset, so you get same belly button but a new location, and the belly button loose skin is all cleaned up. On a mini tummy tuck, just the lower excess tummy skin's removed. There's no work to the actual belly button, and then the six-pack muscle is only tightened from the belly button down to the pubis, not the whole tummy wall. In regards to a thigh lift and when you can return to work and return to activities, that's typically 2 to 3 weeks where you would be out of work and subsequently even out of driving in that first 1 to 2 to 3 weeks. In regards to returning to exercise after a thigh lift, I typically have the patients wait 6 weeks. They can walk during that 6 weeks, and we encourage walking, but anything more aggressive, it would be 6 weeks.